The CDC recently revealed a dramatic increase in overdose deaths. They say the biggest jump in deaths happening in April and May of last year when COVID fears were running rampant and almost everyone was quarantining. Here to talk more about it, Vice President of Addiction Services at the Hartford HealthCare Behavioral Health Network, Dr. Craig Allen. Thank you so much for being here to talk with us.
Thank you for having me on.
Well, let's start with what the impact of COVID has been on people struggling with addiction.
Well, it's been to increase use. People that already are using substances to manage their anxiety and their moods are going to use more when there are problems in those areas. And, the situation occurs when there's a decrease in treatment programs available, decreased recovery support programs, and decreased harm reduction on top of an unprecedented situation where you have unemployment, increased leisure time on your hands, and you're getting these stimulus checks. So you've got money and nothing to do with it. You can't hang out with your friends. One thing you can do alone is to use substances, and that's really dangerous with things like opioids and all drugs.
Obviously, this report comes from the CDC. How does that align, those statistics align with what we're seeing here in Connecticut?
Yeah, unfortunately, we're also seeing a significant increase. We had our highest numbers ever in 2019, and boom, that went up by 14% in 2020. It's driven by a number of things. One of the things is fentanyl, and that's this really powerful opioid. It's getting into everything, and during the pandemic, you don't have the dealer that you usually go to, you don't have the source you usually had, and that makes things much more dangerous. The numbers in non-Hispanic blacks, the rate of opioid death topped non-Hispanic whites for the first time in a long time here in Connecticut.
Wow. And as we kind of talk about people who are struggling with addiction, what are the obstacles that they face when trying to battle this abuse?
The usual stigma, discrimination. On top of that, we've got the pandemic, so there's fear of going into programs and disconnection from usual sources of wellness and support.
Now, you have a lot of resources available. Can you talk to us about some of the treatments available at the Behavioral Health Network?
Yeah, in addition to medication for opioid use disorders, the most important thing in a substance use disorder is being engaged. And we have virtual programs, in-person programs, hybrid programs, mixed programs, and we involve recovery support specialists and a smartphone, telephone application that helps to keep us engaged and connected to our patients. The opposite of addiction is connection, and that's what we're looking for.
And if anybody wants to find out more information, is there a website they can go to?
Absolutely. Hartford HealthCare has a website with our phone numbers on it, and you can reach us directly through there.
Perfect. Dr. Craig Allen with Hartford HealthCare's Behavioral Health Network, thanks so much for being here with us again today.
Thank you.